Welcome to Health Focus, where we focus on your health. I'm your host, Dr. Scott Anderson. May is National Asthma and Allergy Awareness Month. The Asthma and Allergy Foundation of America is active in publicizing this awareness event, but we also fight this battle in our local communities day after day. Although a cure for these conditions is not yet a reality, we have more effective treatments than ever before. That's important because asthma results in 10 fatalities a day in the United States. We're talking 25 million of our fellow citizens who wheeze and cough and have symptoms due to this condition. If one considers the number of persons with allergic disorders in general, the number approaches 50 million. Today we are fortunate to have with us Dr. Emerita Brigino-Buenaventura, Chief of the Allergy and Immunology Department at Napa Solano Kaiser Permanente. Please join me in welcoming this distinguished guest. Dr. Brigino, it's really a pleasure to have you here. Thank you so much for joining us on Health Focus, and especially at this time of year.
Yes.
Maybe you could start by just telling us a little bit about your background and how you came to be an expert, as you are, in fact, a division chief at Kaiser, in the area of treating allergies and asthma.
Well, I come from a family with asthma and allergies. My grandfather and two of my aunts actually died of asthma. So asthma can be a very severe condition.
I'm
Yes.
sorry to hear about that loss. You know, I'm actually, as you know, a rheumatologist, so my training was in a similar field to yours,
Yes.
but I understand that you entered allergy through pediatrics, whereas I entered rheumatology through internal medicine.
Internal medicine, yes.
So tell us a little bit about how a pediatrician would become an expert in allergies. What does that entail? It must be just many years of training.
Yes. So after medical school, we go into residency and either pediatrics or internal medicine. And from there, if your interest is on allergy and immunology, then you can become a fellow of allergy and immunology. So whether you're a pediatrician or an internist, we are trained in both taking care of adults and children.
Do you interact very much with the internists and family practitioners and perhaps even the rheumatologists and allergic or immunological issues?
Oh yes, yes, because immunology actually is in every field of medicine.
So it's a team effort.
Yes.
Maybe you could explain a little bit to our audience about what it really means when someone says that he or she has an allergy. What does that really involve?
Yes. So a normal person actually, you know, you can live life, have pets around you, garden, and the flowers and the trees will not affect you. And you can be beside someone who is smoking and you're not affected. But in patients with asthma, they have a problem in their airways. Airways are tubes that carry air in and out of the lungs. And what happens is these tubes, they are like an inverted tree. And this is the trunk. And then going into the lungs are the small branches. And they are inflamed, or what I mean, swollen. So similar to your skin, if your skin becomes swollen and inflamed, it can become very sensitive. So even, you know, like if you have normal skin, you do that, that's nothing. But if you have an inflamed skin, you do that, ooh, you know, that's painful.
Yes.
And that's how your airways react. When it is inflamed, it becomes very sensitive and it easily gets irritated.
So I guess when we're talking about allergies, we're talking about a large family of conditions.
Yes.
Where the body sees something foreign like pollen or mold and reacts to it. And within that family of conditions, asthma is one of the diagnoses.
One of the diagnoses.
Now, when you see someone with asthma, do you generally find that you have to do testing to confirm the diagnosis?
It would be worthwhile because one of the ways you take care of your asthma, it is very important to have a knowledge of what your triggers are, because in that sense, then you can try to avoid it. And sometimes you would need skin test, blood test for allergies, to test for your allergies, and knowledge is power.
Knowledge is power,
Yes.
and we are actually about empowering people on Health Focus,
Yes.
which is why we're so happy you're with us. So obviously in the United States, with 50 million people with allergies and so many people with asthma, not all of them really are going to have an opportunity or perhaps even a need to see an allergist, but some of them will.
Yes.
How do you decide who these asthmatic individuals are who really need to see an allergist?
Yes, so majority of asthmatic patients can be regularly seen by their regular doctor, nurse practitioners, and we do have even in big institutions, you may have asthma care managers. But when the asthma becomes severe, which can be seen in about 5% of cases, or if asthma is due to allergies, then those patients get seen by us.
Now, I know that at Kaiser, you probably see patients in different settings, for example, in clinics and in emergency departments. I believe, in fact, you have a comprehensive program of some kind for asthma, do you not?
Yes. Oh, yes.
Could you tell us a little about that, please?
Yes, so we have actually a very united effort in Kaiser. Actually, the asthma patients are, of course, the first line of defense, or would be the primary care provider. And helping the primary care providers are, we have asthma care managers, the pharmacist, because they take note of whether the patients are indeed taking their medications that will prevent their asthma. And we have, of course, social workers, and then we have the specialists, both allergists and pulmonologists.
And when they come to see you and you start to look at tests, you'll order the tests, I imagine, based on the specific needs of the patient. So I'm thinking you might order blood tests, of course, to look for certain changes in the white blood cells, perhaps. And then, of course, allergists are famous for skin tests.
Yes.
Do you perform a lot of that kind of testing to see if somebody is allergic to a particular tree or plant, perhaps an oak tree or a bluegrass or whatever it might be?
Yes, we do perform a lot of blood or skin tests, yes.
And what part of the body do you test when you do that? Before I went to medical school, I did some skin testing for an allergist as a pre-med person, and we did it on the arm. I believe it's done sometimes on the back as well.
Yes.
How do you handle that in Kaiser? Or in your practice, I should say?
Well, right now we can either do the skin test or the blood test. You
Yes.
know, we test for pollens,
Right.
for pet dander, dust mites, and mold, and also foods.
Okay. And while we're on the subject, we talked a bit about asthma. You explained that the bronchioles or the tree of the lung sort of constricts.
Yes.
Can you tell us a little bit more about that? There's also, for example, production of mucus.
Yes.
So in children, I guess they wheeze, right? What else do you see in kids? How can you tell that they're suffering from an asthma attack? How can a parent tell?
Yes. So in an asthmatic airway, so the airway is so sensitive, and when it gets triggered by irritants, and the irritants can range from pollens, dust mites, the things that we mentioned, but also smoke, cigarette smoke, and what just happened in October, the Napa Sonoma fires, which really affected a lot of our asthmatics. And of course, pollution, even emotions, stress, hormones can affect asthma. Now, what happens is there are two main pathology in asthma. So your airway, there's a tube like an inverted tree. So there are muscles that surround these tubes. And one of the ways when there's an irritant that comes in your airway, like into the nose, then there will be this asthmatic airways will then constrict. So there will be narrowing of the airway.
Yes.
Yes. But you see, in the beginning, way back in the early 1970s, the doctors thought that it was only mainly bronchoconstriction that is causing coughing, wheezing, or chest tightness. So they were giving albuterol to everyone. And even the doctors, when you give, when patients are given albuterol, which is a bronchodilator, it will open up the airways. Wow, it's magic. The cough and the wheezing goes away, right?
Right.
But unfortunately, there are different kinds of asthmatics. There are seasonal asthmatics, there are difficult to control asthmatics or persistent asthmatics. And after about a year, when albuterol was invented back in the 1970s, the doctors were amazed. Oh my God, people are still dying from asthma. And in fact, they did a research and they found out that the incidence of mortality even increased with the introduction of albuterol. It did not decrease. So they autopsied the patients who died from asthma. And what did they find? They found that the lining of the tubes was very, very swollen and full of mucus. So air cannot get through. So no matter how much you open up the airway, the constricted muscles around the airways, the patient still died.
So Dr. Brigino, that could be due to either the asthma or perhaps even a side effect of the albuterol, which could increase the pulse and so forth. So, but it certainly shows that we were not getting at the root of the problem.
Yes.
So let's say we want to get to the root of the problem. If we could avoid pollen, dust, et cetera, and these terrible smoke exposures that we had during the fires, which I certainly was wheezing with as an asthmatic myself. It was just terrible and people even without asthma were having trouble. Well, let's say we want to avoid these exposures. How can we do so? I guess being in an air-conditioned building with central air conditioning helps, right?
Yes.
Do you have any other specific suggestions to diminish the exposure to these harmful agents?
Yes. It is very important to try to avoid your triggers. So some triggers are obvious, but some triggers are not. Some you don't know what's happening and you just have asthma all year long. So triggers like pollens, they come in seasons. Trees bear flowers in spring. And then the grass in Napa Solano, in the hills of Napa Solano are all green. So if that's the time that you are having hay fever symptoms and you're also having cough, chest tightness and wheezing, so most likely then your asthma is being triggered by pollens. And of course, the cat, the dog, they can be triggers also. Yes. And when you take a vacation away from your dog, out of the house, and then you notice, I'm not having asthma. And then you realize, it might be my cat.
Yeah, I remember seeing a lecture once where an allergist had a picture of a cat in the back of a car and said, send your cat away in the car. But people don't want to part with their animals.
Oh, yes.
So that's a tough one. How about HEPA filters?
Yes.
What does HEPA stand for, first of all?
High efficiency particulate
air device?
Air device,
yeah. Okay.
Yes.
Do you recommend them?
Well, some patients will say that they help them. And some studies show that actually it does help asthmatic patients. It helps patients clear the air of mold, pet dander, and cigarette smoke, and pollens too. But it does not help for dust mites.
All right. So let's say that someone is on the proper medication and is trying to minimize exposure, and the person wants to go jogging.
Yes.
Is there a time of day that you would recommend, say, particularly during the spring and summer when we have so much pollen?
Yes.
When should they exercise?
So pollens are usually released in the very early morning, and also they start to be released in the middle of the afternoon, like 12, 1 o'clock. If you happen to be near a tree, and sometimes if you see yellow smoke right beside the tree, run, because that's a pollen smoke, pollen cloud. Don't go into it. because unfortunately some patients sometimes go into it. No, run from it. And so as the atmosphere heats up, these pollens are then blown by the wind several miles. Yes.
Very good.
So don't exercise
All right.
very early in the morning or late in the day.
Very good. Dr. Brigino, I know you brought some audiovisual aids. So many of our viewers may have asthma and may use inhalers. Perhaps you might demonstrate for us some of the information that you brought along in terms of
Yes.
illustrating this to your patients, particularly maybe the spacer.
Yes.
Can you tell us what you have there, please?
Yes. So I mentioned earlier that there are two problems in asthma. So patients will be given actually, the patients may be given two kinds of inhalers, and that's the reason why you have two kinds of inhalers that may be given to you. If you're an intermittent asthmatic, sometimes just one inhaler will be given to you, what we call albuterol, or what we call a quick relief or emergency inhaler. There's another inhaler which we call preventer or controller, and these medications carry steroids inside them. And for these inhalers to reach all the way down to the lungs, it is best that you use an air chamber.
So
And the way to use the
explain
air
that,
chamber, yes. If you spray your inhaler straight to the mouth, and then they will say to inhale it very quick.
Right.
The physiology is it actually will just impact your mouth because your mouth is very wet. But when you use this air chamber, what happens is the particles are then floating here in this air chamber, and then you can now slowly inhale the particles, so that it will not stick in the sides of your mouth, and it can really reach all the way down to your small airways. So I will demonstrate the correct way how to do it. You shake it first, okay? You exhale to empty your lungs, and then you close your mouth around the mouthpiece.
Okay,
And then press, then inhale slowly, and then you hold your breath and count for 1 to 10, and then exhale. So I will do it now.
Okay. So Dr. Brigino's exhaling. Looks like 2 sprays and a deep inhalation. And Dr. Brigino's holding it in her lungs for 10 seconds and then inhaling. So instead of this medicine simply being dissolved in the back of the mouth with the saliva around the tongue, it's getting deep into the lungs where we need it. That was really an excellent demonstration, Dr. Brigino, and I think that our viewers now have a better sense of not just the importance of the medication, but the importance of administering it properly. And in fact, I believe studies have shown that in terms of what we would call adherence to medication, taking medication, it used to be called compliance. Inhalers are one of the toughest ones because it takes so much time and effort to use them properly.
Yes.
People just don't bother. And the inhalers end up at the bottom of the drawer.
Yes.
But I think they're so important, and I think that education really tells us that.
Yes.
And I think it's also nice that you're administering the medication where you need it, in the lungs.
Yes.
Although you do on occasion use pills as well, do you not?
Yes. So there are now some pills that can help for asthma, which are also anti-inflammatory, although they're weaker. One of them is Montelukast, others are Accolade and Xyluton, and this is what we call anti-leukotrienes. Yes.
So these are some of the newer agents.
Yes.
Do you see any additional new agents on the horizon that are just beginning to enter the field? These are already quite new ones, I know.
Yes. We have a lot now of biologic, what we call biologic therapy for severe asthma.
That's interesting
Yes.
because we use some of those agents in my own field of rheumatology, for
Yes.
example, for rheumatoid arthritis. Again, we're trying to suppress the immune response,
Yes.
but not so much that people get infections and other problems. So how about specific desensitization therapy? For example, if you find someone is really allergic to some inhaled substance, will you give them allergy shots to try to cut down on that?
Yes.
Or is that something from yesteryear?
Oh no, we definitely, allergy shots is, I believe, one of the best treatment that we can offer. Because most of the medications we now give for asthma, once you stop taking them, even the new biologics, once you stop using them, your asthma is back. They just control your asthma. But with allergen desensitization, you literally, we call it a disease-modifying treatment. You change the body's way of reacting to what they're allergic to.
Very good. So you're kind of getting at the root of the problem.
Yes.
Yeah, which makes so much sense. Now, we're getting towards the end of our time together, and I just want to sort of get into the area of when someone with a child with asthma or when someone with asthma should consider perhaps either going to the clinic, calling the doctor, or even going to the emergency department. Particularly as the weather heats up, are there any warning signs that you can tell our viewers about that tell them, gee, you should maybe get in touch with your doctor or seek help?
Yes, I am glad you mentioned that. And we actually have what is called an asthma action plan.
Okay.
And it is very important because this also gives control to the patient. They feel like they are in control. So when everything is well and you're not having any cough, wheezing, or chest tightness, some patients who were controlled by these medications, the preventer medications or the controller medications, they need to take them daily, especially during the pollen season, and then the albuterol only as quick relief. If you hardly need your quick relief medications, that means that your asthma is in good control. That is what we call the green zone. So you continue just taking your preventer medications. Because the bottom line with asthma is that your airways are sensitive. So you cannot literally avoid all the triggers that you are, that is that you're living with in the environment. So to make your life feel as if you're a normal person, then this is one way to control asthma. You have a preventer medication. So when everything is fine and dandy, you're in the green zone. Just continue taking preventer. However, if you're taking your preventer medication regularly, but despite that, you're starting to have breakthrough coughing or wheezing or chest tightness. In children, they may even say, oh, I have a tummy ache or my chest hurts, then, or they're needing to use the albuterol 3 or more times a week, then that is the caution zone or the yellow zone. That's the time you call up the doctor, and your asthma action plan, your asthma nurse will actually state there, increase your preventer medications. If you were only taking your preventer medications once a day, that yellow zone may say increase it to 2 to 3 times a day. Now, so when you institute that and use more of your albuterol, when you institute that, and despite that, you're still, you're not responding to your albuterol, you can hardly talk or breathe, and everything is worsening, your coughing is even worsening, then that's the time you go to the emergency room.
Now, if someone goes to the emergency room who is not a Kaiser patient, that person will still be cared for. I believe that's the tradition at Kaiser, and it's also, I believe, required by various regulations.
Yes. Mm-hmm.
So if somebody is really in distress, that person could go to the nearest emergency room.
Yes.
With or without health insurance, the emergency room has to take care of you.
Yes.
And that's important because as we have, for example, episodes of extreme heat in the North Bay, people do sometimes actually have health emergencies related to that. So that's so important. As we get down to our closing moments, Dr. Brigino, do you feel that the future looks bright in terms of better treatments for both allergies and asthma? Are you optimistic as a subspecialist in asthma, as an allergist, as a pediatrician? Does the future look bright in this field?
Oh, of course, yes. And more than ever, the positive thing with asthma is now we have a lot of treatment that we can offer that can control your asthma. Patients who used to go to the ER once a week, if they start their preventer medications, wow, they're like anyone else. We have children who have asthma who became star athletes, who are star athletes in their track field, you know, in football. You know, I have patients who have Olympic medals.
Oh, that's fantastic. So
lead normal lives.
What we're really talking about is not just having people feel well, but we're actually talking about allowing people to live a full, complete life.
Yes.
And that's so important. Dr. Brigino, I just really want to thank you for not just appearing on Health Focus in honor of this important awareness month, but also for all that you do for the community as a healthcare provider in such a critical and important field. It's really been just a pleasure to have you on the show. I hope you'll come back and see us again.
Yes, thank you so much.
Thank you. Well, we've only begun to really scratch the surface of Allergy and Asthma Awareness Month, but I think we've made some progress, and this is a really important area, so I'd just like to acknowledge the superb input that we got from our expert consultant, Dr. Emerita Brigino-Buenaventura. I'd also like to acknowledge the kind assistance of Public Affairs Manager Dilena Harris of Kaiser Permanente, who really did everything possible to make sure that we had an appropriate guest to educate the public. And I think that speaks highly to the values of Kaiser Permanente in our community. So remember, here at Health Focus, we focus on your health. So until next time, all of us here in the studio wish you the best of health. Bye for now.